just disappeared. There we are. I'm here to talk to you about how we've integrated NeoGen into our practice, but also to give you a little bit of personal insight and, I don't want to say wisdom, maybe experience is the better word. So I'm very glad that my slides match up to Raj's already because the backgrounds are the same. So I'm going to go through a little bit of background about myself and our practice, then talk to you a little bit about what spoke to us with regard to NeoGen and what the appeal was from NeoGen to us. Then a little bit about how we sort of sell NeoGen. I hate the word sell as a doctor. It doesn't feel quite right, but we do all own our own practices and businesses. So unfortunately, money and selling does have to come into it. Then a little bit about our learning curve since we brought NeoGen into our practice. And then finally, the question of would we do it again? So my background, notice how my slide has only got 3 lines on it. Raj's was full. Notice how Raj had 60 minutes, I got 20 minutes. So by virtue, I am 1/3 of a man of him. But I am also a surgeon by background. I was an orthopedic surgeon for many years. The scars on my knuckles have disappeared from where I've been dragging them along the floor for so long. But as Raj rightly did say, we are both members of the Tioxane Dermal Filler UK Educational Faculty. And a bit more about background. Disclosure first of all. I am not being paid for this by NeoGen today, as long as I don't think so. Everything I am telling you today is not as a salesperson, not as a marketeer. I'm telling you this as an honest doctor, and it's all of our experiences with regard to it. So there are going to be some potentially slightly home truths as well, but fortunately not many. So we have a practice called Romsey Medical Practice. We established in 2012. We're based in Hampshire in a place called Romsey, funnily enough, which is halfway between Southampton and Winchester. We started off doing very much injectables, sort of neurotoxin, dermal fillers, chemical peels, skincare. But I think my wife, who is sat there, very much my better half, and I found that we were lumped in as kind of glorified beauticians, which didn't sit that well with us. I'd spent a lot of years training to get to where I was, and she, as a consultant nurse in emergency medicine, had also spent a lot of time training to get to where she was. So we wanted to go down a bit more of a medical route. So we've actually set up a medical practice now where we encompass private GPs, we have dermatologists, we have 2 minor operating theatres for minor procedures, we have a gynecologist, we're registered with the British Menopause Society. In addition to our medical aesthetics, we also have nutritional therapy and physiotherapy. So we're very medical in that sense, and this is another reason why NeoGen for us was very useful. Our first encounter with NeoGen was actually in 2022 at CCR. And we, any of you that have been to these conferences, every single person there displaying and selling their wares. I don't know about you, I get a little bit overwhelmed. Everyone's saying that their thing is better and their thing is better. But I kind of recognised this bloke over here who's just been on stage. So we took a little bit more of an interest. And just as Simon said earlier on, we came to that symposium that was downstairs in November 2022 and were swept away with what we were shown. And we'll get into that in just a second. So the appeal of NeoGen for us, what was it about NeoGen that appealed to us? Well, Raj put a really lovely cartoon. Apparently he hates this picture now of solid, liquid, gas and plasma, but I've taken it straight from the website, Raj. And the idea is it is the 4th state of matter. The way I simply explain it to patients is if you've got nitrogen gas and you put a level of heat into it, it separates it into its component parts, which is kind of what Raj said in lots more words. And then it's storing energy. It's excitable and it's excited. And it's when those 2 components and those separate components come back together that it releases the heat that comes out. So very simply, what we put into it, we get out of it. So if you dial up the energy level on the system, you're going to get more energy being deposited in the skin, i.e. more depth of penetration. But the technology has been around, as everyone said so far, since 1999. Simon, was it Cardiff University or Swansea University? Yeah, sorry, I went to Cardiff University, so can you have your machine back now, please? I don't want to be part of this place anymore. Cardiff. No, it's UK-based technology. It's a UK-based company, and the technology has been around for a long time. There's a lot of research behind it, so we felt comfortable with that. The patients. A lot of you have probably seen this, and the man who was responsible for these photos is sitting over here taking more photos today, Sean. Shirley Ballas, obviously very well known in the public eye, but she speaks to our patient demographic. The people that we treat in Romsey are very much women in their 40s, 50s, 60s, some of whom have had cosmetic procedures before, some of whom are very, very against the idea of it, some of whom absolutely can't stand the idea of anybody noticing or having any downtime, some of whom are very against the idea of looking fake, fixed, frozen, etc. But also lots of the same concerns: pigmentation, fine lines, wrinkles, rhytids, on body, off body. So the fact that NeoGen, and I say about the patients, but I could also say the marketing here, they have the people that we want to treat. So obviously Shirley Ballas was one. They've had Nikki Chapman as well recently. For anybody watching from around, not in the UK, these people are well known in the UK. You may never have heard of them. But a lot of my patient population will identify with these types of people. And we found that by offering the neurotoxins, the dermal fillers, the skincare, we were missing out on a whole sort of realm of things that we could treat. And depending on what device you look at, you might be able to hit one or two certain aspects, but maybe not all of them. And Raj showed that lovely slide before comparing the different ways in which heat energy is delivered and the different types of treatment with ablative CO2 and other microneedling devices. And the thing with NeoGen is it covered all bases. The other thing, as again he's already mentioned, is the separate FDA and CE clearances that NeoGen have. And it's very unique in that other devices will claim to be, and rightly so, FDA approved, but they may be FDA approved for one individual indication. They don't tell you that. They just say we're FDA approved. The good thing about NeoGen, very open, very honest, they say what all of their separate approvals are. And for us, as I've mentioned, we're a very medical establishment. We have a dermatologist. The fact that they have FDA-approved cosmetic indications as well as medical indications such as seborrheic keratosis, actinic keratosis, and viral papillomata, not to mention fungal nail infections, etc. That was also what was really useful to us. This platform, this one device, this thing that you see just to the side of me now, can cover all of those things. There's such a level of control and a breadth of things that can be dealt with. There's research. Currently, 50 plus clinical papers written about nitrogen plasma technology and NeoGen. So for us, whenever we're introducing something into our patient practice, we first of all want to make sure that it's safe. We want to make sure it's effective. But again, being very medical, we want to see the research behind it. So I'll be honest with you, I've not read these, but no, I've read all of them, yeah, all of them. And I've critiqued them all. It's all part of my continuing professional development. But the fact there is a lot of research there is really reassuring. As we know, this technology has been around for a quarter of a century. The level of control, he didn't have this in his slides, did he? So this is what's going on in the handpiece. So as he said, you ultra high frequency heat application to the nitrogen gas within the handpiece, which then results in a plume of plasma being ejected and penetrating the skin. Anywhere from 0.5 joules all the way up to 4 joules. And what you'll see is the red bit and the orange bit are different each time. The so-called zone of penetration and then the zone of thermal necrosis. And the idea is the control that we have means that with a 25 millimeter tip or a 5 millimeter tip, we can go from low to medium to high energy, and we can very much control exactly what the patient is experiencing and what they're looking to achieve. So there it is, zone of thermal damage, zone of thermal necrosis. This is what he's saying about the natural skin barrier. So the skin stays in place almost until the new stuff is ready to come through. I say to my patients a little bit, it's like baby teeth and adult teeth. Your baby teeth don't fall out until your adult teeth are ready to push them out. Very similarly here, the top level doesn't come away until the new stuff is ready to push it off. Very simplistic, but Raj has already shown that he's a simple man. Variable depth of penetration, as we said, histological sort of confirmation, slightly mislabeled in that the low energy is up to 0.8 joules, and then the medium is from 1 to 2, and then high is 3 to 4. But as you can see, there's this so-called zone of cleavage, this line of cleavage, this white line that comes on a diagonal here. And basically anything that sits above that line is going to die and fall away, and anything below that line is where you're going to get the new formation of tissue. So as you can see, the deeper the penetration, the more damage there will be, but the more potential for regeneration there is. So that variable depth of penetration based on individual patient expectations and requirements is really useful. Also the downtime. Now these are taken directly from some of Tyrone's training slides, and credit to Dr. Nina Deep for these. Up in the top corner you're seeing the sort of downtime for a low energy treatment, as Raj has already shown. So day 1 to day 4, the fact is, with a low energy treatment, someone will look like they've got a very mild sunburn potentially. They might be a little bit pink for a day, then they might get a little bit dry and experience nothing more than sort of facial dandruff, which is very manageable. And they can almost, especially for the patients who don't like to tell husbands, partners about what they're having done, they can almost explain it away as a bit of an aggressive facial, which technically they're not wrong. However, obviously in the lower pictures, we can see day 3 and day 4 in the corner, just like we saw with Raj's patients there. Someone does look like they've been in a house fire or run over by a tank. And so obviously, depending on how well you get on with your patients and how much expectation management there is, you can show them these sorts of photos. And I'm sure Raj and the guys from NeoGen will be happy to share, typical progression. Certainly within our consent form, it says that our patient is consenting to say that they've been shown a typical sort of recovery from the different energies that they receive. So that downtime is very, very manageable as well. In the case of Shirley Ballis, and Sean will probably be able to correct me if I'm wrong, because of her commitments and going across and being on TV and being in America, etc., she couldn't really afford any downtime. So Shirley Ballis's treatments were over a period of 11 months at low energy. And the first photo was from February 22, and then the second photo was in January 23. So over an 11-month period, that's what was achieved, but at no point did she have any of this particularly.
Just quickly, it was just 6 treatments at 0.8.
Perfect.
And the second picture was in August.
There we are then. So even, see, I've learned something there as well now. What else do I like? Well, it's these guys really. So it's the team and the training. So he's hiding over there, but he's also hiding in his photo as well. Tyrone is the lead educator for NeoGen, and he's the person that's come around and has trained me and trained probably lots of you who already use the system. The level of support you get from NeoGen is absolutely incredible. It is a UK-based company. It's manufactured in the UK. They are based in Swansea, Cardiff. But you can pick up a phone, you can literally speak to someone, and very quickly you have access and you have that level of personal support that you might not get from other providers, devices, distributors. As Simon said, the team has expanded quite a lot, and some of the faces that were on board when I started and Emily started are no longer here. Absolutely brilliant. Susie was one of the original product specialists and salespeople. Absolutely brilliant. She's moved on, but thank goodness for her, because she was fantastic. And obviously the new guys have come in now. Welcome. I've said hello. Please don't judge me. And what's another reason then why Emily and I thought that NeoGen might be a good option? Unfortunately, it's this guy. You may or may not be aware of him because he's been on stage for 3 hours already. But as he said, we do have a history, we do have a past. I know him personally and I know him professionally, and I actually trust him, believe it or not. I've tried to pretend I didn't just then, but what was really useful is I could use him as a sounding board. And it's lovely to have someone that you can actually approach locally who can show me his photos, not just sort of glossy magazine ones from America, Australia, or Canada, or wherever else it is. He actually showed me raw photos of his patients, pre and post. So I was able to get a really good understanding. And he's obviously towed the party line today and told you all the things that NeoGen want him to tell you, but he actually didn't tell me anything differently personally. He's actually said there are some things that I would have done differently. I'll explain those in a minute. But the fact that I trust the guy, I like the guy, don't cry, this is your life. But that was one of the reasons why we felt comfortable and confident to be able to invest in this device. So how do we sell NeoGen? Again, selling is a horrible word, but we do have to say it. That's actually our dermatologist there. And I should say our dermatologist came with us to CCR when we first looked at the device. And she's big into science and science of the skin. So she was impressed with it. So the fact that she was impressed with it, we're like, oh, it must be pretty good. So that was another reason why we came to the symposium, and I suppose the rest is history. But one of the things that we can sell with NeoGen is the pain. And the fact that we can dial the pain down or up depending on the level of energy that we put in. So certainly at the lower energy treatments, below 0.8 or even the low ones, you can simply use topical anesthesia. We use EMLA 4% or LMX 4%. As Raja just said, there are some stronger numbing creams available, Receptura being an option. We slightly shy away from it because it's oil-based, it's quite greasy, and it's just a bit of awkwardness to put on and to take off. But it's an option, it's available. Patients describe NeoGen as if you've ever, hopefully you have at some point, fried an egg or cooked bacon, and you get that little fat spit. They say it's a little bit like just a little bit of fat spitting on their skin. Obviously, some areas of the face are more sensitive than others, so periorbital, perioral can be a little bit more sensitive. But by and large, with our patient demographic, they've always reported the discomfort level to be anywhere between 2 and 5. 5 being at the slightly more sensitive areas and at the slightly higher levels of energy. Unlike Raj, I don't block everyone that walks into my clinic, and I never have blocked anyone yet. So I'm looking forward to the day that it has to happen. But at the moment, we've been getting great results without needing to dial up that pain level or that level of anesthesia much, much more. Another way that I sort of sell it to patients, I love an analogy. I love giving a sort of a little story and painting a picture with words. So I use the DIY sandpaper analogy. And I'll look in my clinic room at my wooden windowsill and I'll say, if I was doing my DIY and I was ready to prepare this woodwork for painting, I could use an industrial belt sander with very coarse sandpaper, and I could blitz this paint windowsill within minutes. However, the amount of noise, the amount of mess, and the amount of clearing up that it's going to take is actually quite a long time. Alternatively, I could use a very fine sandpaper, small pieces, and just take small bits off at a time. Ultimately, I'm going to get to the same result. It's just with the fine sandpaper, it's going to take me a lot longer. It's going to take more time. It's going to use more pieces of sandpaper to get the result. But the cleanup in between is simply a damp cloth and wipe it away. Very quick, very easy, and there's none of that big, scary, noisy machine to use. That's how I sell NeoGen. I will say that a high energy is like coarse sandpaper with an industrial belt sander, whereas low energy is that fine sandpaper. I've generally, and I'm glad that Raj kind of sort of agreed with it earlier on, will say that one high energy treatment is the equivalent of 3 medium energy treatments, which is the equivalent of 6 low energy treatments. So if I position it like that right at the beginning and manage that expectation right from the start, people know what they're getting into. My low energies, I will normally separate them by a week to 3 weeks each time because the recovery is actually quite quick in between. Medium is more like 2 to 4 weeks between medium treatments before I repeat the next one. The other thing that's really useful, and I can tell our patients, is that unlike other devices, and Raj has already mentioned one that rhymes with Smorpheus wheat, those results come through quite late, as in all the energy has been deposited deeply. And so it's going to take 6 months for those results to come through. And what we know is by default aesthetics and with perceptual drift, no one really remembers what they looked like 6 months ago. So potentially their level of wow or impressive outcomes is lost in that long period of time. The beauty about NeoGen is that you get results in the short, the medium, and the long term. So in the short term, you get that fine skin tightening. You get that slight improvement in tightening early within a couple of weeks. Medium is where you start to see those improvements in pigmentation, fine lines, wrinkles, pore refinement. So you're starting to see these results coming in from sort of a couple of weeks up to a few months. But again, if they're seeing a little bit of a progression already, they're much, much happier. And in the long term, got to be really careful how I use the words. Do not say lift, do not say lift. You get the tissue tightening, not lift. And then that's when you get those improvements in things like the eyelids, in the lower face, in the jowl, in the nasolabial fold. So that takes up to 6 months. So the beauty is that people see all the way through this progression. They feel a lot more comfortable, a lot more happy that what you've sold to them, again, I hate the word selling, but what you've promised them, perhaps, is actually developing. So that, for me, was another big factor as to why NeoGen was a really useful device to bring into our practice. But now let's talk about the hard truths. Our learning curve, what's wrong with them? Right, so in all honesty, I started by asking Raj, when we first bought it, before we first bought it, I said to Raj, right, if you were going to go back and do it again, what would you do differently? And he's already just told you on stage, he said, I would have been less quick to go to high energy. And he's just said that now. He went high and fast, and then he pulled back. But hearing that, I think we've gone too conservative. I sell a lot more low energy treatments and courses of 6 than I do medium energy. And we've just seen with Raj's pictures there, a lot of the results were in that sort of 2 to 2.5 joule range. So I need to grow a pair and start actually trying to push the medium energies a little bit more. This is obviously a representation of heat. I don't know why I couldn't find anything much more. The Scoville scale. Along with that then is costs. What I haven't mentioned about one of the benefits with NeoGen is consumable costs are actually very, very reasonably priced. We bought a tank of nitrogen gas when we bought the system, and we still haven't had to refill it. Maybe that means we're not doing enough, or maybe it means that the system's really useful at using nitrogen gas efficiently. So, and it's not that much. How much is it, Emily? You'll tell me. 50 quid? 50 quid for a canister of gas, and we've had it for a year, so that's pretty good. The tips obviously are a consumable as well. The gentleman behind was asking. So in a low energy tip, 25mm tip, you get 3,000 shots with that tip. So 1,000 shots for a face. So we get 3 faces out of 1 tip. That's majority single pass with maybe some focal double passes in the areas of main concern. In the 5mm tip at medium energy, you get 2,400 shots. So again, we work on the idea of 800 shots for a full face. So again, we get close to 3 treatments per tip. So return on your investment is actually really, really useful. However, we set our costs wrong. I think I followed Raj a bit too closely and followed the market sort of average. And what Raj had already said is he got the device in the hands of his therapists relatively quickly. So the low energy treatments were being done by his aestheticians and his therapists. We don't have any therapists in our practice. We are medical and medical only, so everyone is regulated by NMC, GMC, GDC, HCPC. So any treatments that are done by us. So while he's out swanning and having a lovely time and they're all earning money for him, unfortunately, we're having to earn the money ourselves. And what we did was we charged our low energies at the same as he charged his low energies, but that was with a therapist doing it versus a doctor or a nurse. And as a result then, our mediums were a higher price point. And I think that puts off some patients when they look and go, well, I don't want the downtime and I don't really want to pay that much money for a medium. So I spoke to Justin at ACE this year. Spoke to Simon and some of the guys as well, and I think we're going to readjust our pricing points because the actual tips cost the same. You get more shots in a low energy tip than you do in a medium, but you just reduce the number of shots accordingly. So for me, I think a cost for full face, regardless of whether it be low energy or medium energy. Obviously, if we're getting up to the high energy, then I might be slightly different because that's going to take a lot more hand holding. We are going to have to do facial blocks, etc. So, but I haven't done any high energy yet, so watch this space. And finally, oh, what's happened there? Let's close that. Something's popped up. Finally, the hype. A normal bell curve distribution is that you have absolute terrible at one end and you have absolute unbelievable at the other end. My experience with NeoGen. What Raj has shown you pictures-wise and what you see in the NeoGen literature and Shirley Ballas, they're all at this end. They are outstanding. They are incredible, right? Is that an everyday normal occurrence? I'll be really honest, I don't think it is. But everybody is this side of the curve with NeoGen. I have none down that end, which for me is brilliant. It means it's safe, it means it's effective, it means that we're getting good results. What I'm not necessarily achieving, and this could be, as Raj has said, there's a lot of differences in how people, and I might not be using a high enough energy, as I said, because I need to grow a pair. But everybody is within this half of the curve. So you're getting good results, sometimes wonderful results, but there's a reason why I've not got my photos published in the NeoGen magazines at the moment, partly because my patients are all very private as well. They don't want anything shared. I don't know what he does to get all these people to consent to having their photos shared. He's a charming man. But I think that from my understanding, and this will come with any device, it's not just NeoGen. You look at all of the devices, they will all say what an incredible result they have. Rubbish. Let's be honest, they're showing you the extremes at this end. From our perspective, we've had nothing down that end, which is in itself an absolute testament to the device. So then I suppose the final question is, would we do it again? Oh, Emily there. So when she had her medium energy full face, I thought it was around Christmas time. I thought she looked a little bit like Marv from Home Alone 2. Yeah, and so we put that on our social media. Couldn't really help but embarrass her again today. Would we do it again? Absolutely yes. Even with all of the knowledge that we got, I think I would have made some of those adjustments and changes that I've said, but from all of the other things that I've said, what we looked at when we first looked into NeoGen, what we purchased and what we've been delivered, can't fault them, definitely would, but I don't work for them and I'm not a salesman. Thank you very much. Any questions? Stunned silence. Lovely. Have I caught? Am I basically? I'm about 10 minutes. Yeah, I'm about 10 minutes.
We're going to start